and welcome to Round Robin. I'm your host, Robin McCormick, with the city's Communication and Marketing Department. And today we're going to talk about a topic that a lot of people don't think about on a daily basis, but our guest today does. He's Chuck Hall, and he heads up the Community Services Board. And that organization helps people with mental illness, disability, intellectual disabilities, and some other issues. So welcome, Chuck. It's good to have you here.
Thank you, Robin. I appreciate the opportunity.
I have to say, I have heard your name associated with this agency for as long as I've been here, which is a good 30 years. Is that about your time frame?
Robin, our agency is 41 years old, and I've been here for 30 years, so never a dull moment.
Wow, that is quite a commitment to the cause, I assume. You want to tell us a little bit about the agency and who you serve?
Yes. Most citizens don't know what CSB, or Community Services Board, stands for. We're an extension of local government. We serve Hampton and Newport News.
So you're one of those regional agencies that has streamlined and cut overhead in order to cross city lines, cross those boundaries.
For over 40 years, we have been an example of how local government can blend opportunities and challenges across boundaries, and I think we've done it very successfully. While Hampton and Newport News are our responsibilities, it's interesting, we also serve the entire region of Hampton Roads. Citizens come to us from all over Virginia Beach, North Carolina, but our primary responsibilities are to serve individuals with behavioral health issues, mental illness, serious and persistent mental illness, intellectual and developmental disabilities, and substance use disorders. And the population we serve is actually begins at pregnancy. We serve women who are pregnant, postpartum, all the way through individuals who are aging and have dementia.
So now, how would a pregnant woman come to you with?
Well, it's interesting.
Substance abuse or?
We're required by the Code of Virginia to link people to appropriate services, whether they have resources or not. So people who come to us aren't required to be impoverished. They can have resources.
Okay.
A physician who is treating a woman in a hospital through her pregnancy may conclude that this individual needs to come and have professional services in the behavioral health arena.
Gotcha.
There may be chemical dependency issues. There may be depression. That person would be referred to us, and if she wished to come, then we would help her through the behavioral health issues.
Okay.
But you asked the question about regionalism. I want to go back to that because we have a model that our board of directors embraces of working across boundaries, working with all of the human services agencies, what we traditionally call social services.
Right. In Hampton, I know we call it human services.
Human services, or the aging services. We work with the libraries. We also work with the private sector. We're one of the best partners of the private providers in Hampton and Newport News, particularly the hospital systems. So whether the person who we serve is homeless, and we do serve homeless individuals, or a former member of the General Assembly with health care insurance, they can come to us and receive the same services.
And to do that, you said you have case management services, which I'm going to guess means you look at the big picture and help link that individual to things. Maybe it isn't always your agency, but other groups could help provide. How does that work exactly?
Well, the Code of Virginia, the General Assembly recognized that people with behavioral health issues or other complicating health challenges might need assistance. And so the Code of Virginia requires all of the 40 CSBs to provide this case management service. And what we do is link people to the appropriate service. Whether we are a provider or a private provider can do a better job. So we link that person, and we're required to help them gain primary health care, dental care, maybe it's ambulatory assistance if they're physically disabled, or if they need behavioral health services.
Okay, so what that might be would be someone maybe who's homeless, who you're treating for whatever that mental illness is or whatever conditions they have, but to look at the whole spectrum of what they need and to try to cover the other things as well.
Let me try to give two good examples. A child in special ed may have some behavioral health challenges. attention deficit disorder, or intellectually and developmentally delayed. The parents assume that the school division is handling all of their issues. The school division is handling their educational needs,
right,
and helping the family to deal with a growing young person with special needs. The family needs to prepare for the time when that child graduates and what comes next. How does the family respond to a young adult with special needs? And that's what our case management is there to do, to help the family before age 21, when the child would graduate. Let's talk about an individual who might be, let's give you a good example of a young man who graduated from UVA, first year master's in business, had his first psychiatric crisis, was diagnosed with schizophrenia, frankly, and deteriorated after that. That person, although quite intelligent, was suffering from a brain disorder, and that mental illness was causing bizarre behaviors in the community. Our case management had to step in where a family had abandoned him. Naturally, that kind of...
It's a hard thing for families,
terrible.
Unfortunately. They just don't have the resources to cope sometimes.
And we step in, and we try to link the family and the young man together. We try to help the young man avoid incarceration, maintain a steady treatment regimen, hopefully gain some employment, but certainly some housing that's stable. So that's each end of the spectrum, young, aging, and we believe that each of those individuals, each of those citizens deserve that kind of response from the agency.
Well, and it's certainly less expensive in the long run to treat people on an outpatient basis and within the community than if they get to the point where they need hospitalization.
Yeah, our medical director, Dr. Gill, and I will put in a plug for our psychiatric services, but our medical director says that access to services is the first indicator of quality care. If a person cannot get into care, then it will be very expensive for the rest of us taxpayers, because they will end up in the emergency room, they will end up causing the police headaches, they will go before the courts, they'll be incarcerated. And right now, incarcerating a person locally might be $30,000 to $40,000 a year,
especially
or
if
more.
They have special medical needs.
Exactly. And so if we can serve that person in an outpatient arena, and if we can provide case management, we can reduce the cost to taxpayers.
Now, Chuck, this all sounds really expensive. How are you funded? How do we accomplish this amazing thing that you do?
Okay. The majority of your viewers, Robin, expect me to say that we have local tax dollars supporting the entire agency.
Yes, that's what I think
Right.
the perception would be.
We're extension of local government, and so the perception is state, federal, and local dollars support us. Our model, which is not quite unique among the 40 CSBs in the state, but our model is to earn the revenues to support the organization. Less than 5% of our budget comes from local tax dollars. The majority...
Wow, wait a minute, really?
Yeah,
less than 5%?
Less than 5%.
Of your budget, which is what?
The operating budget is $71 million. That does not include our office complexes. That's our real estate assets are in a...
Right. That is amazing that you... Okay, so where does it come from?
Primarily earned revenue. Over 2/3 of our revenue is earned revenue. So you say, okay, well, what does that mean? It means Anthem, insurance, TRICARE, Optima, Medicaid, Medicare, but certainly all of the insurances. The message I would like to convey is that the services we provide, behavioral health, mental illness treatment, depression, schizophrenia, chemical dependency, addiction to all the drugs of abuse, intellectual and developmental disability services, they hit every family. Families who have wealth that we might not imagine, or poverty that we can't imagine. And so those individuals come to us and they pay us through their insurance to treat them. We're on all of the panels of all of the insurance companies in Virginia. We have 17 full-time psychiatrists in all the specialties.
Oh my gosh, that's like the biggest provider in the region.
It is.
You are really.
We are the largest psychiatric provider outside of the Veterans Administration for community-based services. Child and adolescent, forensics, addictions, aging, adult services. So now what we do, and the reason I focus on the psychiatry is that this is a medical condition we're treating. We're treating it in the least chemical disorder, a brain disorder. In the least restrictive environment is where we want to provide the service. The least costly is what you're...
It's least costly, but it's also probably better for the individual in terms of maintaining his or her lifestyle, being productive if possible, you know, all those things, having family resources.
Well, here's a piece of our philosophy. If a person chooses to come to us and they bring their resources, their insurance, whether it's Medicaid, Medicare, TRICARE, they're taking responsibility for managing their illness. There has to be a partnership with an individual or a family. We're not an agency that says we're going to do this to you, we're going to cure you. You've got to work with us. And so we do not develop dependency for that patient, although a number of our clientele have been with us for years. It's the nature of the illness. They need supports. They may never be perfectly cured.
Right,
they may be in remission.
Right. Developmental delays just don't go away.
No.
And sometimes chemical imbalances need, you know, continuing treatment. So,
Robin, another good example of the return on investment from our organization to the community and why our model is so valuable. Last week in Newport News, there was an adult drug court graduation. This week in Hampton, there was an adult drug court graduation. We help support these individuals through their addiction treatment with the Commonwealth attorney in both jurisdictions, with the judges in both jurisdictions, and with the probation officers in both jurisdictions, with the public defenders. But what happened is, I can imagine your audience reacting to this. The graduates had, each of them, at least 600 days of no drugs, no alcohol, and they paid court cost, they paid restitution, they were re-engaged with their families, and the cost of serving these individuals paled compared to the alternative of incarceration.
Right, that's just such a huge impact on society to have to deal with that at the very end when everything else has failed.
Now, there are a couple of issues that where our local agency bumps up against the preferences of the community. And, you know, I often get this comment, why don't you just hospitalize these people? Why not just put them in a state institution? That's the way we used to think back in the 40s and 50s. We don't do that anymore. So the community...
and it's crazy expensive to do it, for one thing. Not to mention the effectiveness, which is, I assume, what you're going to talk about.
Yes. No, it's so expensive that taxpayers just can't tolerate it any longer, or shouldn't tolerate it. And in addition, it's just not right to put someone in an institution for the rest of their lives. None of us would want to have our civil rights taken from us because of a brain disorder or a developmental issue.
Or our family members. You know, it may not be me, it might be a member of my family or a friend, and you have to think about that person as an individual. It's very easy to see a class of people as something different until you know someone or are someone in that circumstance.
Well, Robin, I'm not on a crusade, although I've been here for 30 years, but there are very few families who have not been touched by what I'm talking about. And if someone says, I've never been touched by chemical dependency, they need to try to figure out how much of their tax dollar goes to support people who are in an emergency room for alcoholism or other complicating conditions, or in jail because of drug addiction. They're touched by all of this.
Right, they are. They pay for it.
They pay for it. But you know, my interest began in college, and I did work at Eastern State Hospital as a young intern, and I figured out that, my gosh, this is not a place for anyone to be living. My own family have had issues with the behavioral health and chemical dependency challenges. I dare say almost every family in Hampton and Newport News has had one of these affect them. If not directly, a neighbor, a constituent, a student, a parent.
But it's easy to sort of not think about if you don't want to think about it. And you think about it every day.
Right.
And so how do people get to you? You said you need willing partners, but certainly some people are referred by the court system.
The courts, the police, The hospitals. We contract with the hospitals and provide consultation. Children who are in school will be referred by a school teacher or a guidance counselor. Parents.
That's a huge resource for families too, to not just work with the schools, but to have the case management in that broader spectrum that you all provide. And I suspect some people don't know that. They think, oh, we're in special ed, everything's taken care of.
Right. We have, in our partnership with the school division, both superintendents, and I must say that the Hampton School Superintendent has been very supportive. What she has done is ask us to be the behavioral health provider in each of the Hampton schools. So we have staff in each Hampton school to help the teachers and the administration support students who have challenging conditions. Now those children will grow up. Our goal is that they never enter our system. So we don't want to see them when they're young adults. Mm-hmm. We want them to be healthy and functioning, but if they have to come see us, we're there for them.
Well, that's really interesting. Now, what have I forgotten to ask you about? Because what you do is complex, and I know I'm missing parts.
Well, there are lots of other responsibilities. Virginia is dealing with the federal government in how to downsize close its 16 state institutions. We have a pivotal role in how to provide supports to individuals who in the past would have gone to a state institution. Or people who are in a state institution need to come out into the communities. One thing I would like to your viewers to appreciate is that Hampton and Newport News government and citizens have embraced our providing services in the community. We're taking people out of state institutions and putting them in our congregate living settings. And the neighborhoods where we are embracing us and saying, we welcome you. And that's not occurring in every community.
It's a scary thing for a neighborhood sometimes, I think. You called it a fancy name, but what we would know it as is a group home.
Right.
Right.
Right. But these communities are very tolerant, largely very tolerant of people who have challenging conditions. And I think we learned that in our schools. And then as young adults, we're learning it. And I think leadership in government is learning it and supporting it. So we have 13 group homes for people with a variety of conditions, for people with intellectual and developmental disabilities. And then we have apartment complexes which provide supervised supports for people with mental illness. We also try to help those private companies that have their own housing options for people with mental illness. So one thing I need to clear up for any viewer is that we don't manage all of the housing in Hampton and Newport News for people with mental illness.
Right.
Just a small portion.
There are private companies who do that.
Yes.
And take insurance or Medicare, Medicaid vouchers for that.
Yes.
Okay.
Now, to go back to your question about what else is there going on, healthcare reform in the country and in Virginia is going to affect people in Hampton and Newport News. I learned this 2 weeks ago that in Hampton Roads we have over a third of the uninsured individuals in Virginia.
Wow.
And I learned, I don't know what the percentage is of veterans, but a significant number of veterans are currently without insurance. So one thing that my board is doing is trying to figure out how can we support people who have behavioral health issues or chemical addiction issues, who are uninsured now and in the future. Mm-hmm. How do we provide accessible services?
So Chuck, if you were to leave our viewers today with, one message about your organization, about who should call you or what people should do if they think, maybe I do, want to talk to somebody about, is this an issue? Or maybe I could look outside for services in a way that I haven't done before because I've tried to manage it myself and that necessarily hasn't worked.
Right. Robin, we still live in an environment where the stigma of admitting that you have an issue is hard to overcome. However, an individual or family affected by mental illness or addiction, or having a child in school working through a curriculum and their special needs children shouldn't hesitate at all, because mental illness is treatable. People do recover from addictions. there is a better life once you engage a professional, whether that professional is at the Community Services Board or in the private sector. Our role would be to help target that individual to the most suitable service option.
So you might be a first step, or you might continue with the treatment, depending on what works.
We could be the very first step. It would be an affordable option, but it would be a realistic option, and it would be a partnering with the customer, saying, look, what do you want out of this? And you want to be served outpatient? Do you want supports? Do you want to be served in the private sector? Do you want to be followed all along your family's challenges, or do you want to have a short-term limited engagement with us? So we're online, Hampton Newport News Community Services Board, hnncsb.org.
Okay, say that again slower.
Okay, Hampton Newport News Community Services Board.
That's how you can remember
Just
it.
Google it. Or hnncsb.org.
Okay.
Our primary offices are right over here in Hampton behind Centera Careplex, and we have services throughout the peninsula.
All right. Do you want to give a phone number also for people who don't have internet access?
Yes, 788-0300 comes into our main switchboard.
Okay. Well, thank you very much, Chuck. This has been very enlightening, and I hope that people out there who are maybe thinking, I've been afraid to reach out, or I wasn't sure what the first step might be, would be able to make that phone call.
Sure. Thank you, Robin. And we're open if there's a crisis after hours. We will respond. If it's during normal business hours, we'll try to respond.
I'm backing up to one thing. I forgot to ask you how many people you serve each year, because I think that also makes people think, oh, it's not just me. It's a pretty hefty number.
Right. Last year we served 13,331 individuals last fiscal year. Lots of folks came in.
So people who have these conditions are certainly not alone.
No, absolutely.
That's an important message to get out too. Well, thank you very much, Chuck. I appreciate you stopping by today.
Okay. Thank you.
And thank you for watching this episode of Round Robin.